I declare open this public hearing of the Legislative Assembly's Legal and Social Issues Committee's inquiry into increasing the number of registered organ and tissue donors.
We go out to hospitals where there's been a catastrophe, particularly for a child, unexpected death, and you're taking an organ from that patient and bringing it back to the hospital where there's hope for a new life and a new beginning. So the contrast to these are enormous. And it's not unusual for us to actually meet the donor family, because the donor families want to meet the surgeon who will be operating on their son. Rather than this impersonal, they'll often want music played that was the music that he liked to play, or she. And so there is a strong connection. You can remove it from that, but it's a very extraordinary human process, and the gift is just magnificent.
We have the largest number of people on our waiting list awaiting kidney transplantation that we've had in the last decade because of the slowdown in transplantation arising from the COVID pandemic, the persisting low donor rates, and the fact that there's no off switch. So people progress to kidney failure continuously.
They think that it's overly complex to register, and they just haven't got around to it. So it's particularly why we use messaging like it only takes a minute, it's really simple and easy, you can save a life in less than a minute. Those sort of messagings actually work really well for young people, and we do use them in our marketing campaigns.
Organ donation can be quite complex, and there can be a number of myths around it, i.e. if I am a donor, the medical staff aren't going to try and save me. That's absolutely not true, because donation's not even considered until it's determined that somebody is not going to survive.
I think it's really important to make sure that we think about communication if it's a deaf and hard of hearing person. We need to have an interpreter there, or basically asking the person what their requirements are in regards to their communication.
There's been a lot of work done over, several years in hospitals to make sure that the opportunity for organ donation isn't missed. There's a lot of guides out there for doctors and a lot of education for doctors to make sure they raise if someone might be suitable for organ donation, to raise that with the Donate Life team. However, many doctors don't realise that tissue donation can happen when organ donation isn't possible. It can happen in conjunction with organ donation, but it can also happen on its own. And many don't know that the Donor Tissue Bank are here to receive referrals and to be able to help them through that process of determining if their patient might be suitable for donation.
Recently, imams and scholars have come out very clearly and said it is absolutely permissible in Islam to donate, one's organs to save the lives of other people and to improve the quality of life of other people. And I think that is important, because that means that from a permissibility perspective, there would be no major concern.
Many countries looking at the Spanish system and to all the successful system consider that presumed consent or an opt-out system is something that is worth it. And of course it is worth it if the community, if the country is very supportive to a change in the legislation. But on occasions what we have seen is that changing or moving from an opt-in to an opt-out system raises a huge amount of debates in the community. It creates a lot of tensions, a lot of work, and we know that the key for success is not a change in the legislation, but essential changes into the way the system is organized and tackled. So in our view, a very important issue is to focus upon professionals and to support professionals and units that are well trained, that are properly covered from a financial point of view, that are provided with guidance, with innovation, with continuous evaluation of results, rather than investing efforts, time and tensions in modifying the legislation.